He's spent over 30 years in the clinic and on the field, supporting both pro athletes and weekend warriors. Now, sports physiotherapist and Coreshorts creator Greg Bay is taking you inside the locker room with the show Injuries, Innovations, and Insights.
Well, good day, everybody, and welcome to our podcast, Injuries, Innovations, and Insights. I'm your host, Greg Bay, creator of Coreshorts, and today we have an amazing guest. We go back in time to 2008 when we first met. He is one of the true clinicians that keeps a foot in the clinic as well as a major foot in the research in the sports medicine world. It is an honor today to have all the way from Zurich, Switzerland, Dr. Mario Bizzini. Mario, you're looking good. Welcome.
Hi, Greg. It's really a pleasure to meet you again, even from distance. But I think we are, over the years, close friends, and it's really great to be speaking with you today.
It is. It just reminds me how easy it is for us to stay in contact, with Zoom and different ways. And, a lot of times we just almost forget to do it when it is so easy. They always say during these times, we need personal contact, and here we are just a click away, right? So it's really great to see you as well.
Excellent.
So one of the most interesting things for me about when we take a look at innovations and different aspects of injury recovery and prevention is the fact that Mario has an amazing history of producing and working on his passions in research that have led to some many great changes in how we approach sport. We go back to 2008, Mario, when we first met at the U.S. Sports Physical Therapy Conference in Vegas. And I remember listening to your lecture, and I thought, wow, that lecture is lining up exactly towards the things that I have done some work on, and also where my passion is. And it really connected me mostly to your brain because of how you think. And you have a really thoughtful brain about sort of global aspects of movement, global aspects of human anatomy and physiology. But most importantly, what does that mean? How does that get interpreted really for us as clinicians in a clinical setting? So Mario, maybe you could talk a bit about your background and some of your work that you've done prior to you sort of joining the FIFA team at FMARC.
Yeah, too many flowers, Greg, here. Yeah, I mean, I'm PT since now, wait a moment, 32 years, yes. And even during PT school, I was interested in sports PT, so I was kind of a massage therapist for a low-level soccer club back home. So then when I finished school, I looked for an orthopedic and sports medicine clinic, and that's why I ended up in Zurich. So first I was in one clinic, then I got to the Schultes clinic, and I got the chance to get involved with orthopedic patients. So at the beginning, more knee, then we had more hips, and cooperation with surgeons, and then try to get some initiatives, very, very small studies at the times, and I had interest. I also had some opportunities where I jumped into as a PT for the track and field meeting here in Zurich. And then then after maybe about 10 years, I had the feeling I had to look for some new challenge, and I went for a couple of years to Pittsburgh. It was not possible at that time to work, but I did a master science at the UPMC Sports Medicine Center there. And yes, it was a great experience. So had the chance to participate in some research in Pittsburgh, which is a great center for this. And when I came back, then everything went a bit up. So I still work in the clinic, so 50%, mostly orthopedic and sports, and then I began in our research department here. Had the chance to begin a little bit with FMARC for the injury prevention programs. It was just at the beginning there, and the development. And then some other stuff. So I continued with a pro ice hockey team for many years. So I did about 15 years there. That's mine. Actually, I love more ice hockey than soccer, but should not say this. Yes, then I continue to have kind of a balance between clinics and research, mostly in research teams. So which I think it's very important. So it's never a one-man show. So you need to work within a team, and then basically I try to do the same today. So even I have a bit changes in the work, but I always try to have both aspects, and then something that by the end led us to meet it in Vegas. At that time, I was already with the International Sports PT Federation. So, and I remember I was there with another colleague from the federation, and with these contacts, it also have been great to have networks all over the world. So, so really, really great to look back and forward to the future as well.
Well, and that's exactly it. Here we are sitting here with 65 years experience now, where we can start talking a little bit like our mentors, except we're sort of in those roles now. And the field is moving so fast, and sometimes we've got to slow it down a little bit. But the research part that you've always taken has always been about the value of the research that can then be applied clinically. And it's not a number of papers that your name is on. It's really got to do with the value of the papers that your name is on. And I always get excited when I get to see there's my great colleague producing more information that I get to go away and benefit from. And a lot of times as clinicians, we don't have necessarily this personal contact with that arm of our education and the interpretation of it. So, Mario, can you touch a little bit on when you started with FIFA, how that came about, and sort of FMARC, and tell us a little bit about that, because when we look at world innovation with sports medicine, that was absolutely a landmark process that really resulted in something that created a complete movement around the world in collaboration. So tell us a little bit how you got involved with FIFA. Tell us a little bit about the FMARC program, and then how that nailed down to the FIFA 11, which was injury prevention program as a warm-up, in particular taking a look at ACLs.
Yeah, so FMARC was found in '94 by the former president, Mr. Blatter, president of FIFA, and with Professor Dvorak, who was at the time one of the head doctors here in the Schultes Clinic. So actually, then in 2002, this professor, maybe I was lucky to be here. He asked me, and then I started to cooperate, and then. Actually, from the beginning, the area, for sure, because of my background and being involved in soccer, football already with teams, and then the job as a sports PT. So he asked me to collaborate for this injury prevention program. So at the beginning, it was a program called 11. So it was 10 exercises plus promotion of fair play. Then actually, which was a little bit, it was already an international cooperation, but at a small level. Then with the ongoing research, we noticed that some changes were needed. So then the 11 plus came, so kind of the advanced version with really a much bigger international cooperation with Santa Monica Sports Medicine Foundation, so Ollie Silvers as an example, with the Oslo Sport Trauma Research Center, Roald Barr and Mikla Bast and other researchers, and this has always been, let's say, my area. So then after a few years, so it was about 2008, that years, 2008, 2009, there was what I think it was an excellent initiative by the former president Blatter, and then it was supported by the executive committee of FIFA, was to not only continue research, but to really do a big push in dissemination of this knowledge to what is often called the football or soccer family. Because actually these programs, it's very interesting to do research and studies, but if they are helping in reducing some injuries, then it's very important that the information is so disseminated as much as possible. So then we got the opportunity to cooperate a little bit around the world, and for me was a big help, not only within the network of the main organization, but having so many colleagues around the world in sports PT or in PT or in among some trainers as well. So this was actually the focus of about 8-9 years. Continuing some research, there has been developments like the programs for kids, 11 plus kids, which it's maybe even more important than the original one. But there has been really a big work done in disseminating information and doing some courses. And of course, you can say you can never do enough, but at least during those years, we tried to do the best for this, and we solved the related barriers and problems that you know as well when you do a work like this. But I think it was a valuable work to do.
Yeah, I think that the value and for being involved for myself with Canadian soccer for 30 years on the sidelines, as a sport therapist, it completely made sense. It's what was in our brains to certain pieces of it. But one of the challenges that we always face is the buy-in. And I think that in the beginning, the buy-in was somewhat challenged because a lot of the coaches were what I'll call old school. A lot of coaches were there because they played the game. And, getting something introduced that's new and also takes up potential coaching time, which reality is if you weave it in, it doesn't. We know that how to weave things in, but the point is that, over the last 20 years, not only the FIFA coaching qualifications, then there's national coaching qualifications, really all now support such a major component of injury prevention and injury care that the new generation of coaches have been able to be brought up under the having the information and the background of really what is going to keep their players on the field playing healthy longer. And then the buy-in over time has increased, and it's been better. So it's always hard when you start something new because you hit with a certain amount of tradition and a certain amount of resistance. But I can tell you that the number of papers that are produced now that have pieces of FMARC, 11 plus in it, get drilled down and support that global project. And that global project really, to me, was the first world project that had a world, established a world sort of beginning on how we look at any sport, never mind just soccer.
Yeah, at least we try to do our best. So let's say maybe, I think you always need to have some leaders. So as an example, in our center, the Professor Dvorak was really a great leader for that. And let's say not only in pushing people to do things for yesterday, not for today, but in putting everyone in his or her competence field, and to give confidence and to support, So and this was really, I think, it was really important. Then it has a lot to do also with passion, passion for what you do. So same as we work with athletes, so it's because we also have the passion to work with them, but it's the same as in another job. Someone is working in the kitchen and they loves to do this, and for us it's sports PT, and then also injury prevention. I think it's one of the pieces in the puzzle. It's not that we are going there and say only this is important, everything else is not important, but we need to see it and to sell it or to promote it as a one piece in the puzzle. And I think it has a lot to do with how you present yourself, how you present the information, and also important is to work together. So it's I also had the best experience, or let's say I always try to do, of course I had to do many stuff under the label of FIFA or FMARC, but we always said, okay, we are here to speak or to work on a certain topic, and we are not here to impose something, but we are just here to propose and to provide some valuable information that may be included in your day-to-day practice, and I think it's at least we thought it was a good way to do like this.
And that specific project wasn't just about the players. It also, at that time, you guys really put a big emphasis on changing the fitness and sort of injury prevention for referees as well. So there was a terrific focus on the other sort of side of the game, is keeping our referees healthy, but also giving them more of a step up in their professionalism, in the sense of having some requirements. You've also been to many World Cups. Tell us about some of those experiences, and maybe about some of the work you did with the referees.
Yeah, actually, I did quite a bit also in refereeing, maybe, but maybe no one else wanted. I don't know, but yeah, actually, it came up at a meeting in I think it was in 2005, and actually, I did the PhD about this actually. So besides the all the 11 plus projects, so because there was a lot of on epidemiological studies on players levels, age groups, and everything, and then I came up with the question, what about referees? And then then professor told me, okay, Mario, you got it. So then now it's your area. Do you have to make out something of this? So then it started with some small project about Swiss referees here, some questionnaires about injuries. Then and then I got the chance to because I was in CNF to cooperate with the FIFA refereeing department, and I had great support from the beginning. So I had the chance to go to the World Cup in Germany, so to the preparation camps and to the World Cup in Germany. Then the next year was the China Women's World Cup, also preparation camps and tournament. And the deal was that I was there performing, trying to get some data about the participating referees, and also help out as a sport PT. So this was the deal and it was also very good because you need to be again in the team, part of the team, not only someone is there just to collect some data and then go out and disappear. So, and then actually this led to a continuation of the collaboration between the departments, and then with the time we tried to have kind of a medical coverage for the referees, so that they were let's say try to follow up the selection during the years, having some medical screening and testing when they were coming to Zurich, some maybe once in the year, or they were coming all to Zurich and they came to the clinic for examination. Then we introduced also cardiac examination because in some part of the world they were not used to do it. And then for the World Cups, like for the South Africa World Cup, Brazil World Cup, we also tried to introduce some additional tools to complement their preparation, and to try to offer them the best support possible. So, as an example, from some let's say maybe supplements, or try to bring in some other additives. We try to maximize the sports PT and massage therapy services. And then I remember we had a nice cooperation for offering for the 2010 selection the Coreshorts, and which I remember it was an highlight for them. And it's also interesting to see that for sure, Greg, in this last year some good research has come out about the benefits of using this. Of course, again, it's not only the short, it's what you do also, but it can be an help. And when you perform at highest level, everything that gives you maybe even small percent benefit, and it's important. And referees at the highest level, they are athletes. It's a particular group of athletes, but they also need to be 100% body and mind to do their job, and everything helps them as well.
Yeah, it really is. It's nice to have that blend of being on the research mode and the clinician mode, because it does give you an opportunity to take a different vision of what is going to allow an edge, and for injury prevention, but also for health reasons, and to take a look at some things that may be more beneficial or less beneficial going forward. I can tell you, I really have always appreciated your scientific brain that also combined the function side of things. And that was a great project in South Africa. At that time, Coreshorts were under Under Armour, but we were still able to take the lighter, the 1.0 version, and at least get some anecdotal sort of thoughts and comments on it. And I'm always appreciative as we try and do better, and build something better with some more validation behind it. So I'm appreciative of those opportunities for sure. So we look at the legacy behind the FMARC 11 Plus, and that legacy is gone on around the world to also take a look at other sports and how they approach. And what's it really sort of fun for me is the legacy of the FMARC 11 Plus has outlasted the FMARC program at FIFA. But being proud of being able to take a look at how that work has spawned so many other aspects and questions that are being answered around the world. For me, that's such a huge value to us. So, at this moment, I just say thanks for that, because it's also about changing the mindset of what collaboration looks like. When we get down to collaboration as well, Mario, you've been on a lot of position papers, so that your expertise in the sports physical therapy world, but also the sports science world, has brought you into a number of position papers. Certainly 2016, the first World Congress on Return to Sport. And then most recently, which of course I've always got an interest in, improving function in people with hip-related pain, that systematic review. I read that, and I read, it's not a paper you can read before you go to bed, because you really want to pay attention to it, right? But with so many different authors as you bring in on this, how do you put together a project of a systematic review? How do you put together a project that you have 26 authors on? How does that happen, and how does it go?
Yeah, these were a bit crazy thing, you can say, but so actually it's so again, it's a big team, and it's also only possible if you have really also networking with some journals. So over the years, I got to be involved with BGSM, where I am still deputy editor there, and a bit representing Sports PT. So also knowing persons at JOSPT, and let's say the first one was really how I could say, it was really the willingness to, first of all, to realize this World Congress on Sports PT, which, by the way, was last year in Great Vancouver. Well, and I was involved many years in the board of IFSPT, and we also had some. I mean, on the paper is great, so many countries, people from all over the world, but it's also very difficult then to realize something, of course, and the support, the financial support, and just difficult. So then in one of my last year there, I gave the idea, yeah, let's try to do a World Congress. Let's get started somewhere. And then we also turned in a bid, and then Bern was chosen. And then, I gave the idea why not to do about return to play. So because it's one of the many, but for sure an important topic for all of us working with athletes at any level, especially at higher level. Even there are so many implications. So then we try to. We also have a good organization here in Bern. So we started the conference back in 2003. So a very good organization here. So the basis was there. We also had a good financial basis to invite people from all over the world. And and then we try to manage to invite the best possible combination of sports PT, researchers, some physicians as well involved, and then of course when you go to these papers, this publication, it's always it's a teamwork. So and then you need so one leading person, at least one leading person. So for the return to play consensus physio was Claire Arden, who was at that time with BGSM, and then became lately became also editor of JSPT. And then for the hip was kind of similar. So we had in 2018, we were planning the conference with the Swiss Sports Medicine Society, and they wanted different topics. I pushed a bit more for the hip because it's also a relevant one, and also yes, and then about the same. So we take advantage about the opportunity to invite many people from many countries, and the support from BGSM, of course. So it was also defined different working groups. Actually, this was a larger project. So some 4 areas were defined, and lots of people were working about 1 year ahead of the conference to prepare, so to do some systematic reviews on these topics. And then we had also an additional 2 days meeting in Zurich after the Bern conference. I had the great support of my clinic here in the Schultes Clinic. So, and we were all here in Zurich, and also then per publication, you have certain leaders for then putting it down, and then you circulate the publication among all people, and yes, and then always the idea is to have one so-called consensus paper, which gives a little bit the current evidence, the current perspective, and so I'm a bit the guy giving the idea and then trying to do the best possible I can or we can to realize it then and to bring it to the end. And we try to always make sure that the people feel well when they come to before and when they come to Zurich or Bern, and try to have a good atmosphere. I mean, it's by the end. Again, it's like being in a team, no?
Yeah, absolutely.
That's the players, the staff, everybody to enjoy the moment. If you enjoy the moment, then you have more chances to have a good outcome.
Absolutely. And you know, what gets me excited about the papers is the knowledge of the past, but it really recognizes some of the gaps for that we need to fill for the future, and taking that responsibility again to leave it in a better place, right, is to say, if we're not moving forward, there's so many different professional groups that are vying for sports medicine space now. We've got, massage therapists, we have sports chiropractors, we have physical therapists, we have athletic therapists. And what's always interested me is I actually never care what your title is, because the research should be the same for all of us, right? The information that we're producing in the field of, in particular, sports and athletics, should be the same references that we discuss. It should be the same. Now granted, we might have a different slant on interpretation at times, but we really shouldn't be bound by whether this was a sport PT outcome paper or an AT paper. It really needs to be the paper based on what the research is, regardless of the professional title behind it. How are you doing in the sense of, we've got to wade through so much different stuff and levels of evidence, with really what I consider to be so much BS out there now, where people make great claims and of course can't back it up. But how's that affected you, and what are your thoughts on that?
So you mean generally speaking? So
yeah, generally speaking.
Yeah, I mean, Yeah, it's a process. I mean, I think when you had the chance also to be really involved in research, and then you have some background to also to interpret what type of publication, what type of message is coming out, then it's much easier, of course, to sort a little bit this evidence. So as you know, it's not, now I say something very simple, but when you have a case report, it's very good. It has its value. When you have a randomized control trial, then it's also some other type of information, some stronger message you can find there. But then we also know when you are in the real world setting, then if you have, as an example, some implementation studies, and there are some in the sports injury prevention world, which can show the real impact of such program, as an example, in reducing injury cost, or in reducing not only injuries, but maybe improving performance, or, as I say, the social impact. It's also another level of information. So I think if you are okay with differentiating these levels of evidence, then it's no problem. So, when you read something, what a little bit how to place this. Unfortunately, yes, maybe because of many reasons, but unfortunately, also, I don't know to say if many, but certainly some some people, they drew conclusion very quickly when reading some kind of papers or publication. So, which then it's always a bit dangerous concerning the validity of that. So again, I think if you can differentiate the infos coming out of all this avalanche of publication and news, everything, it's no problem. Yeah. Sometimes it's a bit difficult to keep the pace of about all this volume, and otherwise, if you're not able to this, it can be complicated. So then it's difficult to have a clear idea. Yes.
Yeah, and I think that we're getting to the point where, as there's so much crossover in information, that we'll see more collaboration in and amongst the different education groups, so that the information starts to be owned by the masses versus owned by a specific profession, because of the fact that the information should be and will be just the right information for everyone, regardless of the discipline that they apply it in, right? So, that's sort of a nice collaboration as well, and that is currently there. But as we start to take a look at some of the other professions.
Yeah, I think just start from very, very simple when you take PT, sports PT, and then and orthopedic surgeons as an example, so which is a classic. And I think for sure at least in the last 10 years so you have more and more, you have seen also some excellent collaborative work also put in terms of publication and congresses, and so this one is an example about this one's a return to play, the hip. We had many hip specialists involved, which, as you know, they are not always keen on the conservative approach, but with the growing knowledge, they have also to see that there is a place for this. And there recently, last year, I was involved in an ACL, also returned to play in Pittsburgh, and there were also many people involved. So let's say from the orthopedic surgeon side, but there were ATC, sports PTs, some biomechanists, and so I think that this is for sure the way to continue in many areas. It's not one group dictating something, but should be the cooperation, the working together. So again, this team idea, no?
Yeah, exactly. A bit like herding cats at times, but with everybody. But so listen, what is Mario Bizzini up to now? What are you doing now? Where does some of your interests lie? What's happening?
Yeah, now it's I'm still here at the Schultes Clinic, so I've been away in the past, as I was telling before, a few years in Pittsburgh, but I'm about 30 years here in the Schultes Clinic, so I still work clinically, mostly we have a small concussion center, so where I am part. Let's say I coordinate the rehab and training team. So, because, as you know, you need many specialists. So, vestibular, ocular, motor therapist, manual therapist, and so forth. And I still work a bit with pro athletes, so mostly ice hockey players and some other sports. And then I also cooperate always with the so-called Human Performance Lab.
Mm-hmm.
It's we have it since also about maybe 15 years here. My colleague Nicola Mafioletti is the head of the lab, and I cooperate in some projects, mostly in these last maybe 10 years, mostly on hip, FAI, so pre-op, post-op, conservative trials. So we keep busy, and then I have still some duties for the Swiss Sports PT Association, other cooperation with, and so forth. So we try to keep busy. Yes.
Yeah. Well, I can tell you got many hats, and for all of us that get to use the information that you collaborate on or that you do individually, is really allows us to excel as sports therapists, because we can reflect back on really valid and important research that really allows us to do a better job. So we could certainly, it'd be great to bring you back on and talk about some of your specific projects as well, because I think that innovation comes not only from an entrepreneurial side, in the sense of producing products, but a lot of that products, even Coreshorts, is based on the research of trying to tell us about how movement patterns work, what's the physiology, what type of compression or load is needed, so that we can then sort of continue to bridge the gap between what we have from information and then how to apply it. So today you've really highlighted a lot of the sort of history and the organic sort of development of what really is the basis for what us as non-researching clinicians can do out there. And like you talked about with the British Journal of Sports Medicine, it's certainly one of the primary go-tos, without a doubt, for to stay up to date and to stay current and also to stay relevant. So it's terrific to have. So Mario, any parting words? I can't wait to when we're offline connect and do that. But
when are you coming to Switzerland?
Well, that's right. Well, right now, not in my plans, but
right now you need to stay safe.
That's right. Yes,
stay safe right now.
I will certainly take you up on that, and we're certainly grateful that you could come and share to the people that get to listen to this and sort of find out what goes on behind the scenes. So Dr. Mario Bizzini, amazing brain, amazing clinician, one of the leaders for all our bedtime reading, and really just a generous and all-around great guy who's so approachable as well. So Mario, thank you. I think you're one of the greatest innovators that we have and connected to, and certainly that we can all give a shout out and just say thanks for being such a great blend of information.
You're too kind, Greg. Thank you for. It's always a pleasure to speak with friends, and you also did some great job too. So we are all together, huh?
Yeah, we're all together.
Going forward.
Absolutely. So until next time, Mario, I greatly appreciate it here on this show of Injuries, Innovations, and Insights. Dr. Mario Bizzini, it's been a great pleasure. Thank you.
Thank you.